There is a microbiome most doctors have never heard of. It's not in your gut. It's not on your skin. It lives in your uterus, your cervix, your vaginal tract. And according to the science, it may be quietly running your hormones, your fertility, and how fast you age. Today I'm talking to Ronny Szelinsky, founder of Get Happy, who has spent years doing original research on the gynecological microbiome in partnership with fertility clinics. What he found is that roughly half the women with a significant bacterial imbalance down there have absolutely no symptoms. None. And that imbalance may be the reason they can't get pregnant, have painful cycles, or are heading into menopause faster than they need to. The gut microbiome gets all the airtime. This is the one nobody's talking about, and it turns out it's more important.
Welcome back to Biohacking Eve, Health Optimization for Women with Judith Miller, where we shine a light on everything that will help you reach your best self as a woman, as unique and individual as only you can be. Live long and prosper, my friend. Hello and welcome back, everyone. Today we're joined by Ronny Szelinsky, the founder of Get Happy.
Hey, nice to be here.
Ronny is a researcher in the space of the female or the gynecological microbiome. So obviously we've talked a lot about general science talks a lot about the gut microbiome, but there's actually a lot more to the body. We're going to talk about that a little bit more today. So tell us, what is the gynecological microbiome and which areas does it actually affect?
First of all, thanks for inviting me, Judith. It's a pleasure. So let's directly jump into the topic where we're talking about the microbiome. And we learned that on the hard way because we talked to so many people and even to a lot of gynecologists, a lot of reproductive doctors. And really, unfortunately, I have to say, a really big part of those people still don't know what the differences in the microbiome are, especially in the gynecological microbiome. I know that your community basically knows what the microbiome is. Maybe just to jump in, like from a top level, we have different microbiomes in our body. It could be the gut microbiome, can be the skin microbiome. We have a microbiome in our mouth. Yes, we have a microbiome, especially like biological female people in their gynecological tract. And every time we have like a cervix, we have different kind of small living species on it, which are like, for example, different types of bacteria, but can also be pathogens, which per se are not bad at all. There are also pathogens where we say, okay, they have to be there. And so in our view, or what we are doing, is to unlock the microbiome in the gynecological tract. When we're talking about that, and we have to say that the gut microbiome and the gynecological microbiome, so the gynecological microbiome is the microbiome we see in the uterus, in the vulva, on the cervix of the urinary tract, for example, and also like an outer microbiome on the vagina. We're talking about the whole gynecological system and reproductive system. This is somehow connected to the gut. That's what we know. We still don't know all the details, how the gut and the gynecological microbiome is affecting each other and is living in a biosis. 100% it is a fact, but we don't know everything. And what we know is that the gynecological microbiome, so the small living species on the cervix in, for example, the uterus or the vaginal tract, is really, really, really important for biological female people, especially when we're talking about cycle health, intimate health, or also reproductive health.
This is interesting because you said you want to slow reproductive aging via microbes. So
Yes.
What does reproductive aging mean in practical, measurable terms? And let's give us a brief overview because we'll go in more detail later of how you want to do that.
And when we're talking about reproductive aging, we're talking about how the reproductive system, also connected to the female hormones, that are like massively important also in the process of aging, are affecting your aging per se. And we're not talking about, that's like basically longevity changed a bit from really living to 150 more to living to 100 maybe, but living in a good way when you are 70 or 80 and that you are fit and everything. And what we see is, just to give an example, basically the later a woman enters the menopause, the longer she lives. That's what we're seeing right now in science. The basic mechanism is that the hormonal situation till the menopause has a protective character on, for example, cardiovascular health. And what we are seeing is that there is a microbial hormonal axis. The microbiome is affecting the hormones and the hormones are affecting the microbiome. So it's in a biosis. So what we see, for example, is that with entering into the menopause, a woman massively and really, really fast loses the stability of the microbiome in the gynecological tract, which leads, for example, to higher health risks in urinary tract infections. We see there's a huge number of people, also like a huge blind spot there, of people that are dying of a sepsis resulting from a urinary tract infection, UTI. And this is a massive problem. Just to give one example, yes. And there, I think even celebrities that had like a situation like that and were dying because of the UTI. Yeah. So, and this is what we see, that we are trying to figure out and to be able to affect the gynecological microbiome in a specific way so that we keep it stable over a longer time, so that it is affecting in the biosis the hormonal situation and the hormonal status of the woman, that maybe somehow will be able to push out a bit this massively changing hormonal situation and microbiome situation.
The interesting thing I found, and this is in many conversations actually, when we say we're trying to slow reproductive aging, it's not really, I mean, obviously reproduction is a side effect of that, but we're basically treating the whole reproductive system, and the farther effects is not about how long you can have babies for, it's much more about your general health actually, what that means on a population level. So very interesting.
Absolutely.
So tell us about, what are any sort of personal or clinical moments that make you choose the vaginal and endometrial microbiomes rather than more crowded gut space, for example?
Because this is really, we can say it's a niche topic, even if it's getting bigger and bigger and bigger, that is a good thing. But when we're looking on the whole ecosystem, how many actors are in the specific topic, there is not that much. In Europe, for example, we have maybe 5 players that are somehow really deep into the topic, that are doing research and trying to bring out, for example, nutraceutical products or to bring out pharma products. But there's not that much. It's really like a niche topic that needs a specific expertise. And from day one, what we were doing, we were not starting with this whole vaginal and gynecological microbiome thing. So we just started with longevity. And because I have a background in female health, so my grandfather was one of the main inventors of the contraception pill. It was ready. We were able to start directly from day one with starting our own research, which sounds easier than it was, because we started to partner with fertility clinics, for example, and we needed like this basic biological material to do our research. And then we started to just try to understand how the microbiome is different from person to person. And if we can find a specific community, a specific strain or a specific set of strains that are outstanding. Yeah. So where we see, okay, this seems to be a pattern or a cluster where we see, okay, it seems to drive reproductive health and fertility much more than other strains. And that's where we did our research on. And we are still in the process, but we were already able to develop a product out of that, which is a specific set and a mix of 6 bacteria, where we found that it was massively impacting the reproductive and gynecological system and health by the inflammation action, for example, or protecting from pathogen. And that's how it was actually going from day one, from longevity to this specific topic.
Yes, I didn't know you were the grandson of the inventor of the pill. Very, very interesting. Let's take a step back. So why are we seeing these changes today? Because obviously, what are the failure modes in the standard of care? Obviously, we've got a lot of antibiotics, antifungals, we're messing with hormones, et cetera, et cetera. What else are you seeing that's actually contributing to this?
First of all, we know some facts that are where we know that it is impacting the microbiome. And there are some facts where we think that they are impacting the microbiome, where we are not like 100% sure from the scientific perspective, but we think that is like one of the drivers. Let's give you one example. Even if I love my grandpa, and I think the invention of the pill was like a huge milestone for like just not just from a biological perspective, but also for female empowerment, to be able to decide over getting pregnant or not. That's a massive milestone. The counter side is that for sure there are side effects and long-term results in the health that the scientists were not 100% sure about. When we're talking about that a woman is taking the pill for 10, 20, 30 years and is then stopping to taking it, I think nobody really did this long-term research. And what we saw when we did our research is that typically after stopping taking the pill, the microbiome is not like restoring or is not like getting in a normal and reproductive state that fast. It takes really a long time. And in the time you're taking the pill, the microbiome is totally different. The colonization is different because we have a synthetic impact on the hormonal situation. And the microbiome is also always in a biosis with the hormonal situation of the woman, with the estradiol levels, etc. And this is like one factor where we see, okay, it seems to be a driver, but there's no big research with 100,000 people on it. But that's what we saw. Other factors that are 100% we're sure about is, for example, it's sexual intercourse per se. When we have like, especially in the typically young ages, so where you have like different sexual partners and it's changing in a high frequency, you will have an impact on the vaginal microbiome. 100%, because also men have a microbiome on their penis, and this is different from man to man also, and it's changing the vaginal microbiome. So, and impacting the vaginal microbiome. And that's what we see as one factor. Also sex toys, it's the same topic. Sex toys also have an impact on the vaginal microbiome. And basically both impacts are, when we just see it as black and white, and we can say good and bad, basically it's bad because it's bringing in pathogens, it's bringing in bad bacteria that are infecting, like inflammation, etc. So what we also see for sure is basic lifestyle, nutrition, obesity, also environmental impact factors, for example, air pollution or things like that. It's all like affecting the microbiome, especially also the gut microbiome, but also the vaginal and gynecological microbiome, because we have a signaling between the gut microbiome and the reproductive microbiome. They are like postbiotics, what we call it, and they are interacting with each other. So they are giving signals to each other. What we also see, what is affecting especially the gynecological microbiome, is besides like the sexual intercourse and the whole situation of how healthy, let's say, how healthy you are living, is for sure all the meds, not just antibiotics. Antibiotics for sure is also affecting it. But we also see that, for example, if you're taking thyroid meds, they are also affecting the whole micronutrient status. And we know that the micronutrient status and your microbiome is also going hand in hand. So it is like massively important. So every time we're taking meds, we have to think about, what is the med robbing from my body? That's important. Nobody's talking about it. No doctor actually, or maybe some, but not that many doctors are talking about that. If you start taking meds, you also have to start taking different things to actually lower the negative impact on your body. What is like the microbiome or the micronutrient situation. So, and that are factors that are mainly affecting also the topic of the vaginal hygiene, for example. People somehow, especially in the young ages, tend to think that it has to be really, how can I call it, clean and totally clean, nearly neutral situation on the vaginal tract. So that it's like, it has to smell like flowers or whatever. If you are a young age, you think that this is normal, but it's absolutely not. Don't wash your vaginal tract with like perfumed shower gels or whatever. Please don't do that. Also, if you use tampons, for example, please look on tampons that are also using lactic acid or something, because also that is affecting the vaginal health. So everything you bring into the system, so on the cervix, will definitely affect and disrupt this really, really sensible and sensitive ecosystem of bacteria.
This is really interesting because, I mean, actually anything you stick in down there, because it's trying to figure the word. In German, we say Schleimhaut. I think it's the endothelial lining, basically. And that means it's very absorbable. So if you put something on your skin versus on any endothelial lining you have, I mean, even, anything in your nose, your mouth, etc., you absorb things much faster, much more.
Absolutely.
So especially if you're using, perfume shower gels and whatnot, that is even more detrimental than it would be otherwise. So where you put it on the body actually does make a big difference. And I'm going to pick you up on one point that I found very interesting because no one talks about. You said, obviously, sexual intercourse, changing partners, and sex toys. Any other than obviously taking probiotics, any sort of care tips, if that makes sense, anything to watch out for?
Maybe I have to divide it a bit from the biological side, what would make sense, and like the other side is how convenient is it. So the best way and the most neutral way, let's say, for the vaginal microbiome, if you have sexual intercourse, is using a condom. So that's how it is. If you use a condom, that's what there's like huge science about that already there. So there studies were made. If you use a condom, the negative impact on the vaginal microbiome is way less than not using it. This is one factor. Also, the second factor is after having sexual intercourse. I don't know if everyone is doing that. I'm not a woman, but typically I know a lot of women, they will use the toilet and have a pee. And this is absolutely right, because this is like a mechanic sector where you actually wash out the pathogens. This is like, I know that some people tend to get bladder infections or UTIs after having sexual intercourse really fast. Yeah. So this is because their microbiome is not stable enough to protect themselves from these pathogens that are getting into the system from their male partner or sex toys or whatever they're using. So this is a fact. And if you're peeing, you have like a mechanism that is actually washing out a part of this bad bacteria and pathogens. And this is really, really useful. So what you also can do is try to, if you really want to have it like in a really clean way, the partner, especially the male partner, should also have a good hygiene, to use like a neutral washing lotion, which is actually made for the intimate tract. And there we have like a more protecting situation when you are not using a condom. I don't know how convenient it is for some people, but this is something that would, from the practical side and the biological side, really make a lot of sense and would have a really good protective impact on this vaginal system. And then, for sure, women that feel or experience that they are really sensitive, that they are really, like, I know that it's like a huge problem. We also see that in our science and research. There's a huge number of people really getting UTIs and bladder infections like nearly every 2 weeks. And then they take antibiotics, and then they have this like bad situation where they take antibiotics, they get like a fungal infection like after taking antibiotics because the microbiome is totally dead. And then they come and do this spiral of like negativity on the microbiome, and they're not really getting out of it. If you feel that you are in a specific situation where you see now it's important, for example, you get UTIs or bladder infections all the time, or you have a bacterial vaginosis, or you try to get pregnant, or your cycle is like disrupted somehow. All this are like factors where you should think about taking specific probiotics that are supporting this vaginal microbiome system, because that can really help. If you have traits that are getting into that and traits that are protective, you really have like a protecting layer. This is like massively impacting it, for sure.
The other interesting thing is on condoms themselves, if they're scented or flavored in any way, that's the same problem we're having, right? So just, there's so many ways to go wrong there. So tell us a bit more about, the gynecological microbiome, in the sense that, to my knowledge, the species are different than they are anywhere else. At least the balance is different. The pH is different. You've also got immune interactions. There's rapid cycling of the microbiome, etc. Tell us more about that.
Yeah. When we're talking about the reproductive microbiome, as I said, we are mainly talking about the vaginal tract and the uterus. These are like the main drivers of the reproductive health. And this is where science was, let's say, 5 years ago, in a completely different direction than we are now. Because 5 years ago, science thought that the uterus is a sterile organ, let's say, or sterile muscle, because mainly the uterus, to be honest, I also always say it's a muscle because per se it is a muscle. It has a muscle layer around it. You can contract it, contracting every cycle when you have your period bleeding, it's contracting and trying to get off this layer to reproduce the layer in a new way. And these are the main drivers. And 5 years ago, the people thought, and also science thought, that the uterus is sterile. There are no bacteria. Why should there be bacteria? And so that could be somehow difficult for getting pregnant and could be like a risk factor. And so the body would not bring bacteria in there. And then 5 years ago, scientists started to really do deep research into it and started to take biopsies from the cervix and the uterus layers and just try to understand, okay, that's what we call NGS, so next generation sequencing. That is where you take a specific biological material and you look on specific genetic sequences that you find there, which is super, super expensive, by the way. That's why also the research was going that slow over the last 10 years, because understanding that is so expensive, especially the sequencing and really finding new strains. So this is like nearly impossible for small companies. Really just the big players can do that here. And that's where the science found that it's not sterile at all. There are like hundreds of different species found. And there people were understanding, okay, there are species, and those species are also really close to the species that we found in the vaginal microbiome. Because like this was what science knowing for decades, that the vaginal microbiome has a lot of bacteria in it. Yeah, so that's normal. And from this day on, it was not sterile anymore. We know that the vaginal microbiome and the uteral microbiome is the microbiome of the uterus is going hand in hand. So it also has a big crossover of species, because this is like, just from the logic, in the end, you have like one cervix layer that's actually going around it. And there we know that there's interaction in this layer. It's not like there's no cut in between where we see, okay, it's not crossing over like the whatever blood-brain axis where we know, okay, there's like a hurdle situation and it's not going over. So it's interacting with each other. And then we saw that this microbiome has a really important axis. And that's where we did our research. And this is like, for me, the main factor there is inflammation. And inflammation is something that I think science is understanding slowly. We are getting a bit away from this inflammation that is connected to like when you have like whatever, an accident, or you hurt yourself, or you have a specific disease and your inflammation markers are really, really high and skyrocketing. And now we're going more into the situation, okay, do we have underlying inflammation on the different biological systems? Yeah. And if you have an underlying inflammation in the gynecological tract, which a lot of people have really, so that you can say it's nearly normal right now, that you will experience a negative impact resulting from this inflammation situation. And then we have to divide it. You have an inflammation that is needed, yes, though, especially in the phase where you have your period bleeding and menstrual bleeding. There you have normal inflammation going on. This is like a signal. This inflammation is a signal giver for starting and actually giving a signal to the uterus and the cells that are actually like in the end resulting or are the base for cramping. This is also why you will experience some cramping. Not saying that it's like normal to have like massive pain. That is really not normal, but per se that the uterus is cramping and the cervix actually like rebuilding. This is a like totally new process, because after you have your ovulation and we are not getting pregnant, the body sees, okay, I was not getting pregnant, I don't need the egg cell, so I have to rebuild it for the next cycle. And this is totally normal. This is like pushing out the old material, building up new material. That is absolutely fine. And this inflammation is a signal giver, and also something that is happening because of this cramping and like rebuilding of the tissue. And you have an inflammation status. And if you would measure in the time where you have your period bleeding, like 1-2 days before and 1-2 days after, you would see that like inflammation markers on this, if you would take a biopsy in the biological material, you would see high inflammation markers. And this is nothing bad at all. This is totally normal. This is totally needed. This is the needed inflammation in the female body every cycle. The thing that we don't want is the inflammation that is going on the rest of the time. Like in a lot of cases, the inflammation is not stopping there. Inflammation is going on because there is a bad population in the vaginal and in the gynecological tract per se, also in the uterine tract, for example, can also be a case. If we see that there's a situation where we have a bad microbiome, for example, we don't have the typical strains, which are mainly Lactobacillus. This is like the main type of bacteria that we see in the gynecological tract. This is different to the gut, for example, because in the gut we have bifidobacteria, for example, which are not there at all in the vaginal and gynecological tract. This tract is actually, there's one rule: the more lactobacilli, the more healthy it is. We actually want a lactobacillus domination in it. And this is also why people, I could talk about it later, they're taking lactic acid, which is nice, but it's actually 5% of the solution in the end, but it's also connected to lactobacillus and lactic acid. And this lactobacillus, if they are somehow disrupted, because you have an infection, like a bacterial vaginosis resulting from Ella infection, for example, which is one of the main drivers. Yeah? If we're talking about bad pathogens, for example, you have something called Gonorrhea vaginalis, and this is like one of the main strains that is like a root cause and a driver for vaginal infections, which can also be a driver for UTI, for example. We also have pathogens like E. coli. We also have pathogens like Streptococcus, where we see, okay, these are also bad bacteria. But we also have specific lactobacillus that are not typically there, but it's the same species where you say, okay, it's the same type of bacteria, lactobacillus, but it's a different species. Yes, it's the same type, but different species. Not Lactobacillus reuteri, for example, it's like Lactobacillus inners. And Lactobacillus inners is something where we think, okay, Lactobacillus, it's a good thing, but this seems to be not a good thing. It's a negative driver. It's causing inflammation, for example. And there are like a specific set, what we know so far, of pathogens and also bacteria that are negative and impacting the whole ecosystem in a negative way. And then what is happening? If you have like these bad pathogens are disrupting the good lactobacillus situation that you would need. Those bad pathogens will lead to the situation that are producing postbiotics, and there are postbiotics, which is actually something that you have like prebiotics. This is, if you would make it super easy, what they are eating. You have the probiotics. This is the bacteria per se, or strain, for example, per se. And then you have the postbiotics. This is what they are producing. And Lactobacillus, for example, is producing at one postbiotic. They are producing lactic acid. That's why it's like the pH situation is basically connected to what Lactobacillus is producing. And if you are thinking logically right now, you would see the less Lactobacillus you have, the less good postbiotics can be produced, the more problems you will get with the pH, the more problems you will get with the postbiotics that are produced by the bad pathogens, from the bad bacteria. And what they are producing is something that are like signal givers for starting inflammation, because the body tries to get it away and starts to inflame the material. And the material which is inflamed is absolutely catastrophic for everything connected to reproductive health. First of all, it can affect the sperm. If you're trying to get pregnant and you have a bad microbiome, which is like leading to an inflammatory state, sperm will have less or nearly no chance to survive in there, because it's attacked by the whole inflammation system in there. For example, white blood cells that are attacking the sperm because they don't divide anymore into, oh, this is a bad bacteria and this is a sperm. They don't divide. They just attack what is in there because they want to get it back into a healthy and normal state. And they just start to attack everything, and they start to attack the sperm. There's also a nice BBC article and also a BBC video where this was shown also in a way where you really can also see it. They showed it in the body, which is super, super interesting. And those sperm are attacked, and they get a problem because you will have the problem with the sperm. And the second thing, if you try to get pregnant and the tissues are inflamed, you will get a problem with the implementation into the tissue, because the egg has to find a way how to get into the tissue to make it nice and cozy to get in. Yeah, so to get pregnant and to be able to, okay, now I have my nice nest, and now the sperm can come and can actually lead to a pregnancy. And if the material is inflamed and the tissue is inflamed, there is no cozy nest and cozy space anymore. The egg cell will have a huge problem to find the place. And the end result is that there is no place at all. The tissue is inflamed, it will push the egg cell away, and you will not be able to have this implementation of the egg cell and have a pregnancy. So no chance. And these are like the two main drivers why people really have problems to get pregnant when they have a situation in the microbiome going on. Yeah, just to give one example connected to fertility.
This is super interesting, because that inflammation that you've just described, so killing the sperm, but also not having a place for the egg to nest, essentially, that is exactly how the copper coil works.
So we now know what the gynecological microbiome is, why it's different from anything else in the body, and how silent dysbiosis can destroy fertility without a single symptom. But we haven't touched the hormone connection yet, including a concept called the estrobolome, which suggests the bacteria surrounding your ovaries may be directly influencing how much estrogen you produce. We haven't talked about the product either. 6 specific strains, taken orally, that reach the reproductive tract just as effectively as vaginal delivery. And there's one more thing we haven't got to: what happens to a woman's microbiome with every birth she has. It only moves in one direction. And the reason why involves what her baby receives in the very first seconds of life. All of that is in part 2.
Thank you for joining me on this transformative journey. Your presence in this community is truly valued. Now, you may not realize it, but your words hold immense power. They have the ability to reach others who may benefit greatly from the wisdom shared here. If you found value in what you heard, I kindly ask you to take a moment to subscribe to Biohacking Eve, leave a glowing review on your preferred podcast platform, and share Biohacking Eve with your friends and family. Your support helps spread the message of health optimization for women far and wide. Lastly, I want to express my gratitude to you for investing in yourself. By prioritizing your well-being, you serve as an inspiration to others. I'm eagerly looking forward to bringing you many more exciting episodes, and thank you for being a vital part of our community. Live long and prosper, my friend. The Biohacking Eve Health Optimization for Women podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be substituted for professional medical advice, diagnosis, or treatment. Users should not disregard or delay obtaining medical advice for any medical condition they may have and should seek the assistance of the healthcare professionals for any such conditions. In addition, the information on this podcast does not constitute investment or financial advice.